much. You take care, too.
Okay, everybody. Want to welcome you back from a short break. We have some additional people in the room at this time, so I would like to ask that if you do have a mobile device, some cell phone or something, please make sure that it's on silent or vibrate so that it doesn't go off during the meeting. We would appreciate that. And Dr. Pilkington, welcome. What I'd like for you to do is to introduce who's with you today, and then we'll just turn it right over to you for your presentation. Okay?
Thank you very much.
Thank you,
Madam Chairman. I have with me today, to my direct right, Dr. Alan Crisell, who's a member of our board and also a physician at Northeast Medical Center in infectious disease. Sue Yates, who's our finance officer. James Mack, who's the chairman of our board, to her right, and sitting behind them is our vice chairman, Tom Kincaid. Also, Steve Morris is another member of our board. To my immediate left, I think I have almost every school nurse that we have who are here tonight, so, and more coming in the door now. So that is our group, and we appreciate your opportunity to allow us to present our case, and we'll start with Mr. Mack doing that.
Okay. Well, again, first of all, we want to say thank you for giving us the opportunity to present our case for the budget request. And our mission at CHA is to achieve the highest level of health, community health that we possibly can for this county. And how we do that is what we want to explain to you today. So next slide, if you could. Sure. Right now, CHA basically represents about 3% of the total budget that you have for Cabarrus County. And we feel like it is essential and it is a vital part of the budget. Next slide. The county-funded expenses by category that represent a part of our budget shows that 90% of that will be for personnel-related costs, and 10% will be for other related costs, which could be utilities and some of the other things that we actually have to use and go through there. But the services that are funded by the county contribution would be the mandated services, which again, 33% would be the total. 20% of that would be mandated services, which would be the environmental health, the communicable diseases, as well as the vital records, and school health would be 13%. The other funding would be coming from federal government, state grants, and things of that nature. Now, investing in public health basically does, from what we're seeing with some of the rankings, the investment given and the funding given in public health does affect the rankings and the health of the county that you would be looking at. And we have some figures from our surrounding counties. If you would look at Rowan County for the fiscal year of 2013, their capital funding was $11.41 and their ranking was 68. With Stanley County, their capital funding for the same year was $7.03 and their ranking was 82. With Mecklenburg County, their per capita funding was $26.03 and their ranking was number 6. And if you look at Cabarrus County, our capital funding for fiscal year 2013 was $18.79, which our county ranking came back at number 9. And we wanted to note that in fiscal year 2011, our capital funding was $21.28, and our ranking came back as number 7. So there's a correlation from our looking at the figures that the investment and the contribution being made does affect the health ranking of the county. And this graph will basically show the per capita funding for the mandated services. And if you look at from 2011 moving forward, the funding has decreased. And I think Ms. Yates will be able to kind of explain in the next slide how that situation is affecting us.
Okay, the purpose of this particular slide is to give a side-by-side comparison of the services that we provide, which are funded by our county dollars. While the total amount to our bottom line has increased due to the reallocation of the school health dollars from the school system to the Cabarrus Health Alliance, it's important to review the funding allocated to mandated services. These services are mandated by the North Carolina General Assembly to be provided directly under the control of a local health director. These services are environmental health, vital records, and communicable disease. From 2011 to 2014, there has been a 12% decrease in the per capita funding for mandated services. The Cabarrus County's population from 2011 to 2014 has grown about 5.41%. The actual dollars allocated to the mandated services has decreased a little over $264,000. That's a 6.87% decrease in funded for county mandated services.
I wanted to also cover some of the history so you understand some of the background on this, because there are several new board members. Back in 1997, the county decided, along with the Board of Health, to split the Health Alliance off from the county. The agreement at that time was that it would be on a per capita basis and that we would not come back to the commissioners and ask for any money ever. We agreed to that. We did that. And that agreement stayed in place until 2008, 2009, when the contribution the county made to us was reduced by 2.9%. I should add that was across the board. I think every county agency got that 2.9% decrease that year. In 2011, 2012, the county manager recommended that the county only fund mandated services, those things that were discussed earlier, communicable disease, vital records, and environmental health, and that not any money go from the county to any of our other services. If you go ahead to the next one. What we did with excess revenue we generate out of clinics is we use that money to fund things like our supervisory nurses for our school nursing program, our information technology department, finance, and a lot of other administrative things that we use that money to cover the cost of. When the decision was made by this Board of Commissioners to not put any money into clinical services, we immediately eliminated 15 clinical positions. We reduced our clinic capacity by almost 30%. The next year, we saw a loss of almost $1 million in Medicaid revenue that we had received in previous years. That was directly related to the fact that we had closed those clinics down to the point we had, and that's because we didn't have the money to operate them. Those clinics are child health and maternal health. Those are primarily the two clinics, women's health. At the start of last year, because we were in such dire straits because of that situation, the county appropriated one-time funding of $300,000 to cover that lost revenue. That $300,000 was primarily used to cover the cost of 2 nursing supervisors for the school health program and an administrative person for the school health program, and assistant. There are 43, pretty much all here, 43 school nurses. They have 2 supervisors. That's well beyond the span of control for almost any organization in terms of how many people you should be supervising. So we feel like we have to have 2 nursing supervisors to cover those 43 nurses. If you eliminate and say you're not going to give us the funding for that, we don't have the money within the public health department to fund those 2 positions. There's no way that it can be done. So we are giving you some options. If the one-time funding is gone, we can cut 5 school nurse positions, eliminating a nurse in every school, or we can decrease the hours of all school nurses, which will leave uncovered daily time each day. Just to give you an impact, 1 hour means 245 sick or injured children will not be seen by a nurse. That's what happens every day in the school nursing program. In addition to that, last night the General Assembly released its budget, and we had been getting one of our school nursing positions funded by the state. They eliminated that. So we won't have that state funding of about $70,000 for another school nurse. I'll turn this over to Dr. Grissel now for some of the infectious disease aspects of it, because both communicable disease and environmental health are key components which traditionally the county barely funds enough to keep going. And he's going to talk a little bit about the importance of those services to our community.
Next slide.
It's back to, that's it.
This one?
Mm-hmm. Oh, yeah, okay. Thank you. So there's some statistics up there that talk about the communicable diseases that we actually see here in Cabarrus County. What's outlined there is actually just the tip of the iceberg. There are many other communicable diseases that are monitored by the Health Alliance. You can see the numbers are rather impressive. 200 cases of Shigella, which is a cause of severe diarrhea. Salmonella, 161 cases in the last 3 years. What actually happens in terms of the nuts and bolts of all of that is when you as a sick individual go to your doctor or the hospital and they do cultures, they'll eventually get a report back. And if it shows one of those reportable illnesses, that information then gets transferred to the Health Alliance. And the reason why that's important is because there's lots of different healthcare providers, your primary care doctors, different hospitals within Cabarrus County, emergency rooms, all of which may be collecting data on sick individuals. And it's the role of the Health Alliance to then take all of that information and actually determine if there's an outbreak going on. And they determine that based on the numbers of cases that are going on, the actual strains of the pathogens that they see. Then if they see something out of the ordinary, it requires a lot of investigations to see if there's a point source. What do I mean by that? Well, is there a restaurant or a water supply that is the source of an outbreak? And obviously that's very important in terms of preventing further cases. And many of these illnesses are very severe. We've had outbreaks of a bacterial pathogen called E. coli 0157, which causes bloody diarrhea, and in children less than 10 years old can lead to dialysis and even death. These are things that actually happened in our county within the last few years. So these are very important functions that are done to protect your health, your loved one's health, etc. Tuberculosis is another big area. This is an airborne disease. There have been 154 cases of tuberculosis investigated, and 91 were what we call latent disease. Those are people that have been exposed to the infection, actually have the infection, but the disease is quiet. It could recur at any time. These people are oftentimes treated with antibacterial medicines to prevent them from getting active disease in the future. We had 6 cases of people with active tuberculosis. These are people that are contagious, that if they weren't being treated properly, would be out in the community transmitting the disease to you, me, and our loved ones. The thing that makes tuberculosis different than other communicable diseases is it's very difficult to treat. You have to treat it with multiple different medications for 9 months. We all have trouble taking medication for 7 days, never mind 9 months. This leads to huge problems, which is a worldwide problem with development of inadequately treated tuberculosis, the development of what we refer to as multi-drug resistant tuberculosis. When you take drugs inadequately, these strains get very resistant to medications. So the Health Alliance, as well as health departments across the country, have programs that we call DOT, directly observed therapy, where people are actually mandated to come in, get their medications under an observed setting. And it requires very intensive efforts to make this done, but it's very important in terms of preventing dissemination of diseases like TB. And you occasionally hear cases where people aren't very well treated, that get on airplanes, and we all hear about these stories, and they're very real. And it requires an awful lot of effort on the part of the people at the Health Alliance to track these people, follow these people, make sure that they're getting adequate therapy for their 9 months, that they require it. Then obviously a lot goes into just environmental inspections to try to prevent any of these things occurring in the first place, things like the Salmonella, the Shigella, and other diseases that are waterborne or foodborne. I'm happy to entertain any questions about this aspect of communicable diseases.
One of the things we wanted to stress today is that we feel like we invest the dollars that you give us in public health very well. Over the time that we have been the Health Alliance, the county has realized almost $2 million in savings, and that's from not having to pay the increased cost in health insurance for those employees, not having to pay salary increases, on and on. We've absorbed those costs over that period of time. If we just took the 81 employees that we have right now in your mandated services and gave them back to you, you would be looking at over $300,000 worth of immediate cost, easily, in your 401k and in your, just in the picking up the difference in health insurance. We have no 401k for our employees. Years ago, our employees decided, and it was their decision, that we needed school nurses more than we needed a 401k. We gave up our 401k for the school nursing program. Went into it in concert with Northeast Medical Center that put $500,000 into it at that time. That's how we got that program started. We also have a very low health insurance cost. Ours are about $2,000 per employee, lower than yours in the county. We have a new facility that was constructed at $122 per square foot. It's a 60,000 square foot building. It came in at $7.1 million. You can run the numbers yourself. I don't know of any other building in Cabarrus County built for $122 a square foot in the last 5 years. If you've seen one, I'd like to see it. We have excellent outcomes. Our infant mortality rate, years ago, I've been in this job now 33 years. When I came here, we were deplorable. Babies were dying in high numbers. Women were showing up at the hospital with no prenatal care. We turned that system around. We have 2 OBs on staff. Women don't come to the ER and the ED and the maternity unit without prenatal care now. We get them prenatal care. Our numbers are among the best in the United States, which is not very good. The United States ranks 21st in the industrialized world in infant mortality. But that is the leading indicator of how healthy you are as a population. How many babies die from birth that are born alive to the first year. So we feel like we're doing a good job in that. The county health rankings that were referenced earlier, the county health rankings are done by the Robert Wood Johnson Foundation on a nationwide basis on over 300 criteria per county you're rated on. We've always ranked in the top 10 in North Carolina. We've slipped every year. We're worried that we're going to slip out of the top 10 this year. We've slipped from the high of 6 down to number 9, but we still are proud of that fact. We're also the only accredited local health department in the southeastern United States. We were one of the first 7 in the United States accredited. So we feel like, given the level of funding and support that we've had, that we've done an excellent job with the money that you've given us.
In order to maintain and provide services at our current level, we are requesting $5,947,987 for our fiscal year 2015. Cabarrus Health Alliance services affect all Cabarrus County residents. Thank you for your time. Do you have any questions?
Commissioners, I'll open it up for any questions or comments that you would like to make at this time.
I had a couple questions. You talked about the ranking. What factors play into that in deriving those rankings?
One of the key ones is life expectancy. So how we rank as a county in terms of life expectancy is critical. One point to make on that is 7 out of the 10 years we've gained in life expectancy in the last 20 years have been due to public health. So public health has a critical role, and a lot of that is in immunizations. Just today in the newspaper, the Washington Post had a story on we have the largest number of cases of measles in the last 15 years. So things are coming back. Other rankings are such as communicable disease rankings fit in, environmental pollution, the number of environmental inspections that you're able to do that you find critical violations on, and environmental health are key. It just goes on and on. There's just a whole, as I said, there's over 300 factors that they rank each county on.
Mm-hmm. You had indicated that the state's budget plan or the Senate budget plan yesterday, which of course we don't know where they're going to land, but that one school nursing position that they have been funding that they're proposed not to fund, that has not been factored into the presentation.
Yeah, we just found that out this morning.
Right. The other question, you talked about the $1 million in Medicaid reimbursements that you lost, because of the change in the clinical services. What was that costing us to get those reimbursements? And my point is, were we investing $100,000 to get $1 million reimbursement, or was it matching grant type of situation, or could you just explain a little how that works?
For every dollar you were investing as a county, you were getting back approximately $10.
Wow.
And because we were able to operate the clinics at the capacity we were able to operate them, we were able to generate, the way Medicaid reimburses is on a cost per unit service. So when we had to cut back our clinics so severely, then our cost per unit of service went up, and then our Medicaid reimbursement, of course, went down because of that. And we had no choice, because we could not fund. One of the things that commissioners need to understand is that we operate on a hairline narrow budget. We have no money. If you look at us compared to any other department of county government, and I will stand us up against any department, we've operated for 15 years essentially with just basically no more than about $150,000 total increase in a year. Now, you shifted all that money from school nursing, but that was just a shift of money. That didn't come into our budget as new money. That just was taking school nurses funded by the schools, putting them in our budget. But the actual new money you gave us, if you look at the budget that Sue's put together up there, we're even asking, we have never asked before for you to pay the portions of the fringe benefits for the employees that you are mandated to provide. We've absorbed that. Dr. Grissel talked about the hepatitis outbreak. 2 weeks ago, we had to respond to a hepatitis outbreak. We had to staff up Friday, Saturday, and Sunday and do almost 800 people, inoculate them for hepatitis A. It cost $22,000 in overtime pay. Mecklenburg had to do the same thing. Guess who paid their overtime? The county commissioners. Guess who paid our overtime? Came out of our budget. Because you're not responsible for picking that up. But my point being that we are operating so narrowly that there is absolutely no room. If the budget stays as it is, it's been recommended to you, we have no choice but to go into personnel. It's, as you saw from the first couple of slides, 90% of our cost is personnel. The only thing we can do is cut people. And that's all we can do to get money. And so we'll have to cut our services. And the point we're trying to make to you tonight is we start cutting services, we start cutting school nurses, we start cutting CD nurses, we start cutting environmental health inspections. The problem that creates for you as a community, and as Dr. Grissel put it so eloquently, is that all of these things that we deal with affect all of you. And if we start cutting those essential people, the next time we have a big outbreak, we had an hepatitis outbreak years ago involving Food Line with 1,800 people that had to be vaccinated in 72 hours. We had the staff to do that then. But when you cut our clinics, or cut your funding to our clinics, and you continue to ratchet down our support, we don't have those people anymore. They're not there to go out and do these emergency night clinics and weekend clinics. It's just, there's not that possibility. And how will I fund another hepatitis A clinic? Which has to be, and if you want to ask Dr. Grissel about it, he can explain it to you very carefully. But those people have to be vaccinated Friday, Saturday, and Sunday, because we lose 3 days of vaccinations, and that's the only time they can be protected. So who's going to go out there and do that if we don't do it? And we're going to have to absorb the cost. I don't have $22,000 next year for the next outbreak. And with the budget that's been presented to you, we don't have any fluff. It's just a basic hairline budget, as I said before. And what we're asking you for there is just basic maintenance of what we're doing already. And I would say it's far beyond anything less than you've been asked for by any other department.
So if we had a hepatitis situation like you just mentioned, 1,800 people, did you 17 or 1,800?
72 hours.
How would we handle that now? Because you say you have produced staff from what you had at that, I mean, what would we do? How would we work that?
I don't know that we could do it. I think it would be really tough to get done again. The one we did with 800 we managed to make, but if we get in another situation where we've got, and I'll give you the worst case scenario. We're also responsible for smallpox vaccination. And I think all of you are going, well, I think probably Mr. Burridge and I may be the only ones in here with smallpox scars on our arms. But we know a little bit about.
Thank you for not saying that.
Well, we do not have smallpox anywhere in the world in existence right now, but we do have 2 places where there are live smallpox viruses. One was in the Soviet Union, one was at the Centers for Disease Control in Atlanta. We don't know what happened to the smallpox virus in the Soviet Union when it collapsed. There's a lot of suspicion and a lot of concern about what happened to it. Was it guarded? Was it protected? Did it get sold? Because of that, we have vaccination programs ready for smallpox. We actually have a huge plan on what we would do with smallpox. We would have to vaccinate 140,000 people in 72 hours, or 50% of you would die. We have pharmacists, we have hospital folks, every school nurse, all these folks are ready to go, but think about the complexity of that. And it wouldn't just be us, it's every community in the nation. But
So you couldn't call over to Mecklenburg County and ask them to send a few
No.
folks over to help?
they're going to be doing the same thing. And the problem is that, I told you this last year, I've been at this job, entering my 34th year. I always felt good about the public health of this community and that I felt like it was protected. It is no longer protected. There is no way we can do the job we're being asked to do with the kind of funding restrictions that are being placed upon us. When we were doing the per capita funding, that at least covered our cost. But starting to say, you can't spend your money here, you can't spend your money there, everything you do is in a contract with the county, and that started with the previous county manager. But it makes it really difficult to do the services we have to do. Fortunately, we have these school nurses to call on. If we didn't have those, I don't know what we'd do in an outbreak, because just in the last couple of weeks when we had that outbreak, they were a godsend to be able to come in and do that. But if we were just standalone health department doing nothing but communicable disease, it wouldn't happen.
I hate to bounce around, but I'm trying to keep my train of thought. You talked about the supervisory positions for the school nurses and what the impact would be. That funding is included in this request to avoid that situation. And you know,
That's a controversial piece of funding because that's considered our one-time funding that we were only get last year one time to fund them. And that was in our contract with the county that's who those people would be funded, or how those people would be funded. Any of these ladies can tell you about the enormity of their jobs. They range from minor things to serious things on any given day. In 1 week, literally, we had one school nurse save 2 lives. Really saved 2 lives. One of them was a teacher who cardiac had down on the desk. She got the AED and brought her back. In the same week, the same poor old nurse, I think, was it a Heimlich maneuver she had to do? Is she here? She's here. And she had two people in 1 week's life she saved. So it can be really serious. My point being, they do hard work and difficult work. They can't be out there on their own because they're scattered throughout the entire Cabarrus County. Some of these issues that they come up with, they need a head to bounce it off of. And Alice and Kim are their 2 supervisors who can say, yeah, we've dealt with that in Wolf Meadow, or yeah, we dealt with that in Rocky River. We know what to do. But if they're out there on their own in the schools, they're on their own. And that's not something I'm willing as a public health officer to say to these school nurses, I'm going to put you out there without supervision. And that's why I said our only choice is to cut back the hours if we don't have the supervision, because we don't have the money to cover it. It's just not there.
Well, I don't make this comment because they're all staring at me. But I will say about the school nurses, similar things that we've talked about with the school resource officers. The nursing part of what they do is a very important service, but my suspicion is that a lot of the other things that they do are equally important as far as the support that they provide to students and the opportunities that they give them to address problems that they might have, that they don't have opportunities at home or don't feel comfortable. So thank you for what you do, and I think it's extremely important. One final question, and I won't monopolize the conversation, but these clinical services that you now are not doing, who's taking care of those people? How are those needs being handled now?
They're not being met. What we did last year was we worked out with Northeast Medical Center for another one-time $50,000 to keep the clinic going another year in women's health, but that was a one-time with Northeast Medical Center. What we did to other folks is we just said, there's no services here. We can only meet a certain capacity with the clinicians and the staff that we have, so they're not getting care.
And so does that have an impact on us in another area, perhaps in Health and Human Services? Is it more, those people that are not providing that care, getting that care along the way, then does that mean it's a more expensive alternative when it becomes an emergency?
Well, I think the school nurses can tell you some of what they've seen in the increase in that already in their schools from children who aren't getting seen in pediatric clinic at the Health Alliance. In addition, there are numerous studies that show that the care you get between the ages of 0 and 6 and 7 before you really get into your school years have direct impact not only on social ramifications but also on crime and other things. Health care is a really important service, especially to those children who are disadvantaged. And we have, unfortunately, in North Carolina, a great disparity in how we take care of people. We have huge differences in numbers in most counties between African American or Latino populations. We have not had that in Cabarrus County. We've been able, through our clinical services up until the last year, to meet that and do, I think, an excellent job of it. But we're not doing that anymore. I don't see in the foreseeable future how we can. It's just impossible to do with the funding that's there.
Well, and I promised I was going to stop, but I will go a little longer. It's very timely that to have this conversation. I attended a luncheon today that included the report from the Childhood Obesity Initiative study that has been occurring, and of course some of the things, we saw some of the situations and talked about the impact of children in that same age range you just mentioned, birth to 5 years old, and the habits that they form and the obesity that's occurring, and the a couple of the videos that they showed were particularly telling in that there were parents that really didn't understand the proper way to prepare food for the children and the things that they should be eating. And of course, you folks came to mind immediately because I know you offer some of those cooking clinics and other things that are available to the community. But another big chunk of that is the increased cost, public cost for these children that are experiencing obesity because of the diseases they develop, the mobility issues, the diabetes, and you're certainly much better versed at that than I am, but I think it's important that we always look at return on investment. And if we can get some of these children off to a good start, we're going to save money down the road. So I certainly think that's something to keep in mind for all of us. But thank you for the information and for what you do.
Okay.
In other words, you're saying if you'd had $100,000 more last year, you would have got that $1 million Medicaid, right?
Well, I would have needed it 2 years ago.
2 years ago.
Yeah.
So you've lost it for 2 years or 1 year?
I've lost it for 2 years now.
$1 million each year?
Yes. Well, I've lost it. Well, I've certainly lost it because the clinic's not in operation anymore at the level it was.
But over $100,000?
Yes.
Did you lose any more funding last year with the government shutdown than what your Medicaid funding?
We lost some of our state grant monies on a percentage basis, about 5 to 7% in almost every category.
You didn't lose no federal funding?
No.
Other than Medicaid?
Federal funding was all, we lost it during the shutdown, but it came right back after it.
So you got all that back.
Yes. And as you saw, that's about 67% of our budget.
How much does the state provide of your budget?
State provides about, Sue, do you know that number right offhand?
I think I have that number, but I can provide that to you within 24 hours to make sure.
Okay, that's fine, thank you.
The interesting thing about the state money, too, is the state money is really not state money. Most of it comes through the feds to the state. They
Yeah.
distribute it. So it's, when she provides that,
So
she'll
it's
show you
all
what's,
basically federal funds?
yeah, she'll show you it's really federal money coming through.
Yeah, okay. Now, the $300,000 you got last year, did that go to school nurses or did that go to something else? Was that
To two school nurses, supervisors, and it went to Shelley, who's their administrative aide. And
218,000 of it went directly to school health.
Did any of that help you pay that $22,000 for giving all those shots?
no,
That didn't help you on that at all?
no, we lost that. So,
Okay.
but we are asking Papa John's, by the way, for that money back.
Oh, are you?
We haven't had a response yet.
Well,
You
maybe
might have
they
said
did.
unnamed pizza company.
Well,
Maybe they'll give it back to you in pizzas.
well, in the other case, Food Line paid us our expenses, so we're hoping that that'll happen as well. We're not
Okay.
adverse to asking for it.
Thank you.
You got these things going today. What is your total budget, including all revenue?
18?
18 million.
18 million.
A little over 18 million.
Okay. My question is, of this 5.9 million, I'm looking at page 92. I don't think that's your whole request. I think it was just a little bit different, but call it 5.9 million round. Does that include the 1.5 million the county pays on financing for your building?
It does not.
Yeah.
I don't think so, does it?
No, it doesn't.
Well, and that's one of the points that we've been talking about, right? When you were at the old facility, I think your rent rate was about $4 a foot. And so if you had 60,000 square feet there, I don't think you had that much, but that would be $250,000 a year that we would pay in rent. And here, we went over and built this brand-new, beautiful facility, and now we're spending $1.5 million, which is a significantly different amount. And I've said all along, would people rather have that type of money going into a facility, or would they rather have it going into the service? And you're saying you'd rather have it go into the service, and we've got it going into the building. And if you take that 1.5 million and you divide it by 183,000 to get a per capita number, we're spending $8 per capita for that facility. And if you add that $8 to your $18.80, you get $26.80, which means we're actually paying the $26 that we talked about, but it's going into the facility instead of the actual public health. And you know, I mean, I think as a community we've got to be aware of these things. You know, when we build these tremendous facilities, it comes at a cost, and now we don't have the money to pay for these other things. The last thing I wanted to ask you about was at the snowstorm. I got a couple of emails actually, and I noticed it myself in the newspaper. It said that your free yoga classes were canceled during the snowstorm, and I think people see some of that stuff, and they wonder, you know, when we hear we've got these urgent needs that we're not going to be able to do all these horrendous things, but we're offering free yoga. I think that computes in people's minds in a different way, and I did receive several emails about it, at least a couple, and you know, I wanted to give you a chance to at least talk about that, and you know, maybe you could tell people where you get funding to do things like that and space to do things like that.
It's free yoga because it's free. The person who does the yoga instruction does it on her own time, and it's after hours. It's done usually on Friday nights. And one of the important things that public health involves is, as Commissioner Morris said, trying to keep us all healthy. And things like, we do cooking classes, we charge for them. We do yoga classes, we have an entire program with the African American community churches where we have weight loss programs and exercise programs. So you may see those announced as closed too, and those are usually federally funded by federal and state grants. We've had a long-term grant with the KB Rentals Association for 13 years funding that particular program. And we just went through a big loser program, is what we called it, and the biggest loser was, do you remember, 100 and something pounds, and the total one church, 800 pounds was lost in. So that's the kind of thing we're trying to do. So when you get those, please tell folks to call me, and I'll explain to them that this is not coming out of their pocket. It's generally some service we've worked out, so somebody's doing it for us. And even our cooking classes, we have people come in. We've worked out programs to have people come in from the community and do cooking for us, who are either trained at Johnson & Wales or somewhere, who are willing to do that and do it for the community service part of it. Public health is an interesting thing. You don't want to get me started on it. I know you're getting close to the end here, but public health is, first public health officer in this entire country was Paul Revere in Boston. And public health is about community. It's about how we can all be better as a community. We have always been in Cabarrus County one of the absolute best. As I said, we're the only accredited one in the Southeast. We were the first community in the entire United States to vaccinate its population against polio in the whole country. So we've got a great reputation here, and I don't take any credit for it. I'm just a small part of the 100-plus years we've been in existence. But throughout that 100 years, this board has been very supportive of public health and has stood behind public health 110%. And all I'm asking you to do is keep doing that, because we're at the point now where we're pretty much in crisis.
I had one more question for you, and I appreciate that answer. I learn things all the time, and I appreciate you giving me such a good explanation. In terms of your clinical services, my thinking has been that these are services that are covered by Medicaid and other programs and things like that. So could you explain that to me in terms of, are the services that you provide insured through other forums, and we provide them in addition, or are they not insured for some particular reason, particularly maternal health and things like that? It does seem like those would be covered by a lot of the other, they would be duplicative of several programs that we offer, either through the state or the federal government. So I was wondering if you could explain that for me a little bit.
We work hand in hand with DSS to certify eligibility and try to get as many people as can possibly and humanly be certified as Medicaid. But aliens, illegals in the U.S. cannot receive Medicaid. Our clinics run 40+%, and people who cannot meet Medicaid standards. All of us have different views on that. My view as a public health officer is I want a healthy baby born in the community, one that lives beyond that first year. And I think, again, we do a good job of delivering a low-cost service for that. And we do a good job of encouraging. The first slide up there was from Fletcher Hartzell saying life begins at conception, but it doesn't end at birth. And he made that statement when he voted against the budget for the state last year. But the important point there is we've got to take care of these babies once they're born, whether they're legal, illegal, or whatever. When they're born, they're U.S. citizens of the United States. And our board has been strong and steadfast about that. And we try in every way to recoup we need the money, so we're trying in every way to recoup the finances. We're operating right now 2 OB clinics. One is an OB clinic for Medicaid, and one is an OB clinic for those who can't afford Medicaid. And those people go through a really strict and rigorous system. So if they can't pay us something, they can't be seen. And that's whether they're legal or illegal. And now, to some extent, we're probably dancing on the edges of what our state contract says, but we've set it up as a separate clinic and said, regardless of what the state contract is, this is all we can do with the state money, so this is what we're going to do with the rest of it. And we were able, at least with Northeast, $50,000 to set that clinic up and make it so that it's operating on closely a break even. What we always try to do in our clinics is operate them at a positive so that they would fund all these other services like school health and such. And we were always able to do that in maternity and in child health, and most especially in dental. We operate a huge dental program, and we can set up our ratios in dental and Medicaid to net $200,000–300,000 a year. And that finances the rest of our operations and keeps the burden off of you as commissioners. So I think we've been good at doing that. But still, your point is correct. There's a lot of people out there that don't have any reimbursement. And if they don't come to us, traditionally and always, in every community, public health is the last resort. That's where you go when nobody else will see you. We have a community free clinic, but it operates only a few hours a week. We also have a federally qualified health center, but it primarily takes care of adults. So that leaves the women and the children without those services. So until we can get enough doctors, when I came here, there were 41 doctors in Cabarrus County, 1977, and now there are how many?
No, I don't know.
500 plus?
Yeah, hundreds.
But that's still not enough for the fast-growing population that we have. So if we had enough doctors, we don't want to be in the clinical business. This is not something we're doing because we think it's fun or we can do it well. It's not something that public health really ought to be doing. We work hard to try to get out of the business, but it's the nature of the county at this point. So.
Hey, I don't take credit for a whole lot of things, but I'm going to say, and I think the people that are staring at my back and not at my face, know, I hope they know, and I'm going to take credit for that. I was on the school board when that program was started, and it was before the state of North Carolina thought that school nurses were important. And as a school board member, we put that in place. Our staff will verify that for 5.5 years of being a county commissioner, that I worked very hard to get our county staff to accomplish what we did last year, which was making sure that the school nurses were funded in a direct manner and not funneling through the two different school systems so that we couldn't track it. I pushed hard last year to make sure that ones that were interested could get health insurance coverage. They are out, and either at the hepatitis A clinic or at the school, and they're around people, and some of them didn't have health insurance, and I thought that was a problem. So I'm going to say to the people behind me that I have a very good relationship with one of you quite often. I won't call you out. And that school nurses are extremely important, and I think the county has done a very good job of making sure that that line item was set up so that their expanded hours last year, their health insurance, and their positions at all of the schools are secured. And there is no reason for them to be concerned at this point in time, as far as I'm concerned, from the county in making sure that they have their positions, because they do a tremendous amount of work. We do have in the budget to fund an additional supervisor for this budget. That's the county manager's recommendation. I know that staff worked really hard on both school systems to account for the employees in that area. So you have here I don't need it right now, but I would like to get it to staff so that we can have the additional information. Increase for school nurse supervisors and admin. I'd like to see that broken out, and I would like to ask staff to review, because I felt like last year we had done a good job of making sure we had identified all of those positions. I think last year you asked for an additional supervisor. I don't believe that we funded that one. I believe there is a position in there. There is a question about the Senate budget, if you're going to get cut somebody. I think that if that comes to pass, there is contingency money that the county has that we need to look at that to make sure that there isn't an impact in that particular area of your budget, because I do think that that's very important, and for 15 years I have tried to make sure that that area was set up correctly so that it did not get impacted. So I'd like that additional information just to make sure that our staff has been able to review it completely. And I know that there were some discrepancies on hours, I think, that different nurses were working, and we tried very hard to make sure that everybody was being treated equally. So I hope that that is in fact the case, and I'll leave that to county staff to verify for us as we continue through the budget process. But I think that this county and the school systems have worked very hard to make sure that school nurses were taken care of. So I'll take credit for that part. As far as the other, things in there, I don't know, will we normally provide a vehicle for environmental? I mean, and the reason I'm asking about that one is that last year we did part of the one for the forest ranger, sorry, I was gonna say fire, and I knew it wasn't fire, forest ranger, so is that something that we normally would do, do you know?
I guess you can look at it two ways. The forester, that's required by statute that we pay 40% of their operations. As far as the vehicle for the Health Alliance, that is within the mandated services of environmental health. So I would think that if they are needing a vehicle, then this board would be the one to fund it.
So, this is the first time that we've seen this actual request, you know, today, that's why we have these meetings. So I guess I would ask staff to just review those and verify. Larry's been one who's asked a lot about mileage on vehicles, and you didn't do that today. I was expecting that from you. Just to verify some details on that. Okay, so I'll add that much.
I'm sure it's old.
Yeah, it's very old.
I'm not doubting that it's old, but I mean, if that's something that we normally should look at, then we need to look and see how that fits in and how that can be taken care of.
I'll tell you how old they are. Some of them came to us from the county, from the sheriff's department, when they were finished with them, and we still have them 15 years later. So that's some old vehicles.
There could be, you know, I don't know what the different options are on that, but I think that if that's something that we should do, if we cover that, that we should look at that, and that should be factored into future budgets, you know, as far as, if there's things like that that we normally would look at. I know you've worked really hard to try to get the different entities that we fund to kind of get in our CIP and make sure that we know these things are coming and we can plan for them. So I don't know if that's one that we should be planning for or not.
And when we had the budget meeting with the Health Alliance, we learned that when we set everything straight with the school nurses, apparently we were not given the 2 supervisors. When we put that funding together, they had stayed outside of the school nurse funding. So they were not included when we set that up 2 years ago. So we did find that out at our budget meeting this time around.
Okay, well, I would ask that you, that staff look at that and make sure that we're doing what we had intended to do, which was to, I mean, I know how much time you put into it. There was a monumental effort. You were funded some directly, both school systems were funded some nurses worked some hours, some had others, and it really was a big task to try to make sure that everybody was treated equally and fairly. And so I would just ask that we make sure that we've done that. And there is in your recommendation is for 1 position, so I don't know if that's in addition to or if that's one of the 2 that were there, but I'll just leave that up to you. I don't need an answer right now, but I would like for you to look at that.
Yeah, we can look at it. I guess my question would be for Dr. Pilkington. The $300,000, from our understanding, was to make up for delayed revenues for last year, and that's what the board said. It was a one-time. That's why I'm asking the 2 nursing supervisors, were they new positions created in this past budget year?
No, they were funded in the past by those excess revenues I talked about that we generated from clinics and such.
Okay.
And with regard to the vehicles, we're very willing to accept surplus vehicles. We don't have to have new. So if the sheriff's department or the county agencies have excess vehicles, that's fine with us.
I want to make sure that program's taken care of, which,
Yeah, and
not
I
to
guess
belabor it, so.
the one that we do have in the budget, the nursing supervisor, is that a 3rd nursing supervisor, or is that one of the?
It's not a
2 that you're-
supervisor. What we have is those specialty schools. It's a nurse for them that would rotate around the schools that are.
Okay, I knew you said it rotated, so that's
Yeah.
why we thought it was.
So it's not a
Can you tell me
supervisor.
who were those? Give me an example of who.
Which schools are they?
Early College, Opportunity, and Mary Frances Wall.
Okay, so I'm going to repeat it since I have the microphone. Early College, which is located at Rowan Cabarrus Community College, Opportunity School, which is located at the Glenn Center, and Francis Wall Center, which is the old A.T. Allen down on 601. So one person would rotate between those 3 and have hours at each of the locations?
Yes.
That's the idea?
And they're very important positions. We had ended up being a fatality from a cardiac arrest at one of those schools very recently, that there was an AED available, but no one was able to use it. So there's critical importance of some of those children need a nurse on hand.
Can you give us the amount needed to fund those 2 nursing supervisors?
Well, we have to also fund the administrative assistant that works with them, because
So there's
you
3
have to have one for 43 school nurses. So.
We'll account for all the positions and reconcile it back.
That's all new.
Yeah, and I just that's why I asked if you could get the detail for that, because Pam, you probably still have the legal pads that you used to figure all that out with to begin with.
I passed that on to Parth.
Okay, Parth has your legal pad. I just know it was a whole lot of work, and it was, I think there was really, at the time, there was a realization at the county level of what was going on, and I don't think it was a complete realization of how that was being split up. They are your employees. In the event of emergency, you're going to call them and ask them to come into work, or strongly suggest that they come into work. And that's what public health's about. So I appreciate all of you that did help with the outbreak. And the other thing I would say is that if an unnamed pizza company, is that what you said? If an unnamed pizza company doesn't come forward, or hopefully it's not going to happen anytime soon, there is a reason for something like that. I've said this 5 years I've been on here to a couple entities. If there's something like that that happens that you really can't plan for, we have some contingency money. I'm not telling you we're going to spend a whole lot, but we might be able to go in halfers with you or something, but we don't know that unless somebody comes and asks. And there have been a couple times when we've got to this point in a year, and I'm not calling you out on this one, okay? You just mentioned this particular incident, but I'm just saying there are other entities that have come forward and we've got bashed because we didn't do something. Well, if you don't ask us, there's no way we can offer anything. So, you know, it's not like we have, you know, $20 million sitting there that's just hanging out for somebody to say something, but if something happens, $22,000, if something happens and that doesn't get funded, and that's something that is impacting, I would say especially impacting the school nurses, then I think that that's a call that you make with the county manager. And the county manager can come, if it's in his guidelines, he can make a determination. If it's not, then he's going to bring it to us and we can look at it and see what we can do. And I think that it's not just for the Health Alliance, but it's for other entities, that it is a partnership to take care of every single citizen in Cabarrus County, and that's how we have to look at things. So I will now get off my soapbox, but I want y'all to know that, okay, in case somebody hadn't told you, I want y'all to know that you've had a voice for quite a long time. And I appreciate the working together to try to make sure these school nurses are taken care of, because they do a lot of work.
I have one more question. In the budget, it says that the $1.5 million that we pay back to Kannapolis is primarily related to the 60,000 square foot Health Alliance building. But I think Dr. Pilkington said that building cost $7.1 million total. I'm curious how we could pay $1.5 million a year for that, and it's a total expenditure was $7.1 million. That math doesn't seem to add up to me.
I don't have the numbers in front of me. We'll get that answer for you.
We're responsible for 50, we agreed to be responsible for 50% of the debt. The Health Alliance building is not the only portion of what we are paying or reimbursing for those projects. Some of it is for infrastructure.
Yeah, it's part of the TIF.
Right, but the
and
budget
it's a
says
$15 million.
specifically that it's primarily related to the 60,000 square foot facility. So I know that there are other things included in that, but that facility is the primary driver of that number. And with it being $7.1 million tonight, I don't know how you pay $1.5 million year after year, and it's $7.1 million. So if you would get me that, I would appreciate it.
Sure.
All right. Anything else anybody wants to add? Okay, thank you. If you can just
Thank you.
you can get the information to Pam and or Parth, and they'll be happy to help us with that. So, y'all are all welcome to stay. I have a feeling that we're going to see an exodus fairly quickly, but you're welcome to stay. But the CVB is next up, so if everybody from the CVB will make your way up here to the front, we would appreciate it. Right here in the middle. I'll sit between you. right. Commissioners, next we have the CVB. Donna, what I will ask is that you will introduce yourself and the other people that are here with you. I don't know if you have anybody that's not sitting at the table, but if you'll make sure you introduce everybody before you start, and then we'll just let you
Sure.
take off. Thank you.
I'm Donna Carpenter, President and CEO of the Cabarrus County Convention and Visitors Bureau. I also have with me John Mills, who is our Vice President, and also Ray Soborowski, who is our Board of Directors Chairman. And I have a couple Board of Directors in the audience, Tim Hagler with the Speedway, and Patrick Coughlin is not on our board, but the Chamber of Commerce has 3 seats appointed on our board, so he's also in attendance today. So thank you very
I will
much.
say that I'm a
I'm
representative.
sorry, yes, you
I'm on the board
and Mike.
So is the county manager at this point.
My apologies for that.
It's all right.
First of all, I just want to say thank you for your time this evening. And after sitting and listening to the prior discussion, I want to tell you that we do not ever take for granted and are always very appreciative that we have a dedicated funding source for the CVB. So with that said, tourism is alive and well in Cabarrus County to the tune of a contribution of $410,000 is what we're looking at this year to the county, with 5% of that being for an administrative fee, as well as 5% going into a sports development pot of money with the county. So just always, I would be remiss if I didn't say what I say every time I sit down, is that we hope that you can take a deep breath while we're doing our presentation, because we're not here to ask you for money. We're here to figure out how we generate more money for you. So with that said, we have made great accomplishments this past year. All of you are aware of our 2020 vision plan, and we continue to work forward with that. We've made great strides in improvements at Exit 49 in the discussions. That has been also turned over to the city to handle, but the governor's office and Secretary Decker and Secretary Tata are very aware of the needs that we have here in Cabarrus County at Exit 49 in order to maintain a level of public safety as well as infrastructure to accommodate all of the visitors that we have here in Cabarrus County, not just during race time, but all the time. And I will read to you, just so that I don't forget, starting in May, every weekend since May, we had Auto Fair, we had NHRA, we had the Mustang 50th birthday celebration, we had Carolina Rebellion, we had Jiggy with the Piggy in Kannapolis, we had the Hauler Parade, which unfortunately was canceled, but there was a lot of preparation that went into that in Concord. We had the All-Star Race Weekend, and then what we just ended up with was the Coca-Cola 600 Weekend. So tourism is taking off. We used to have some lull. We don't. Our staff has worked very diligently during these times to service the visitor throughout all of that. On a sales end, let me back up and tell you that the next step in our 2020 vision plan and what our board has talked about working on and going forward with this year is wayfinding throughout the county. And that's going to be at the tune of probably an estimated $350,000 that we will be investing in wayfinding to enable not only the visitor, but to help new residents be able to make their way through the county and be able to find attractions and things to do and ways to spend their money and make the cash registers ring. So that will be our next phase of our 2020 vision plan. On a sales end, we are getting ready to, no pun intended, well, I guess there might be a pun intended, we get ready to pitch a bid for the 2016 National Horseshoe Pitchers Association World event. And we are up against 3 other cities, and we'll be doing that in July, and we will know before we leave if we have been awarded that particular event. We're excited. We have created an entire marketing campaign around it, and we have this little guy here. His name is Hot Shoe Harry. And, of course, we try to tie in motorsports in almost everything we do because it is the hook and what people know us for. But Hot Shoe has developed a big life of his own, and it's pretty good to be Hot Shoe. He's been seen with a lot of celebrities. He's been seen at all of the attractions that we have here in Cabarrus County, and he has his own Facebook page, and it's outpacing a lot of other Facebook pages these days. So we're excited about this, and we hope to bring back good news after July. It's a 2-week-long competition that would be huge for our community. What else? Going on Faith and Meetings Quest is another, 2 other events that we have coming in. Those are conventions, and they are conventions of meeting planners. So it's a big bang for our buck when we host a convention where we have hundreds of other meeting planners that plan different meetings sitting right here, so we can pitch to all of them at the same time. So those are a couple things coming up. Disc golf is, played a large role in that with the Rotary Club. That is opening this weekend. So yet another competition facility that we will be able to bring people in to stay the night and spend their money. Our destination guide and our website are our calls to action. This year we did something different. We actually have 4 covers, and these are the first 2. This one is gone. We have just a handful of these left because during the Mustang celebration, they went like wildfire. And then over the race weekend, we used this cover, and we have gone through 44,600 destination guides just since April. That is a record for us. We're going to have to probably reorder more than what we typically do. The next cover is highlighting other things that we have to do here in Cabarrus County. We get a lot of criticism saying that we think that there's got to be something more than racing here, and we do understand that. And the next cover is a reflection of the Rocky River with kayaking to show outdoor opportunities for the visitor to be able to do. And then the 4th and final cover is shopping. And sorry, Ray, it's not shopping in the traditional sense. The photo is a picture of the depot and antiquing and picking. So not just saying that we've got all forms of shopping here and ways to, again, spend your money and then go back home. So those are just a few of the things. Our website is doing well. Last year we had 70,000 visits for the entire year, and this year we are already at 112,000. So doing very well. We surpassed, we always like to say this, it's a nice little bragging, right? We're at 27,000 Facebook likes. And Visit Charlotte only has 16,000. So we always like to put a little plug in there. So we're no longer the bedroom community to Charlotte. We like to call ourselves the rec room community to Charlotte, that everyone in Charlotte comes here to recreate. So with that, I could keep talking, but I won't because we only really had 3 minutes. But I'm going to turn it over to John Mills to talk about the numbers.
All right, awesome. Well, good afternoon. We are going to be we're presenting a budget of $4,251,467 for FY15. Last year we were right at $3.9 million. So we've done very well, and we're pacing to forecast the end of the year a little more than $4.1 million for fiscal 14. And so we do 3 things as we look at those budgets. And the first thing that we do is we do look at actual past performance. So we'll take July and at this point all the way through March actuals revenue that we've received, and we'll plug that in. And then we'll also talk to the hoteliers. We try to find out and forecast what they're seeing, what their expectations are, if they're planning flat or modest gains. And then we look at what we call citywides. Donna talked about the Mustang 50th celebration that occurred in April. Of course, we receive our revenue a month after the hotel occupancy occurs. So if we realize that event's not going to repeat, then we might come down a little bit month in that particular time frame. So we're looking at $4.2 million. We start obviously with the amount of funds that are going to come out for dedicated programs. Obviously, the administrative fee and the sports development program that's in place. Again, so that's $425,000 that will be coming back to the county for those 2 different programs next year. And then, of course, after that, we have 3 major categories of expenses: our salary and wage expense, our administration and operation expense, and of course sales and marketing. So 3 major categories. And what we do as a bureau is we look at bureaus throughout the country. We look at comparable bureaus with number of people. We look at comparable bureaus with our budget size, and we'll take a look and see, you know, how they're spending their dollars and how they're allocating their dollars. I can tell you, from an industry standpoint, you can see most bureaus spend around 40% of their dollars for salaries and wages. We're going to be right at 33% next year. From an administration and operations standpoint, most bureaus sit around 17, and we'll be about 15 next year. And from a sales and marketing standpoint, 43% is what you typically will see, and we're running right about 52%. If you take and look at the budget for last year going into this year, we've been able to actually, as a percentage of budget, reduce by about 2.5% our salaries and wages as a percentage of budget. On administration, about 0.5 point. And so those 3 points that we gained, we threw back into sales and marketing. From a dollar standpoint, it's about $4,000 more in salaries, about $25,000 more in administration, but it's going to be $277,000 back into sales and marketing. A big portion of that, obviously, related to the wayfinding program. There's $150,000 that's seated there to begin to look at potential RFPs and do some analysis and begin to look at implementation costs that will be needed as we go forward. So again, the goal is always for us is to control fixed cost and push the money into sales and marketing to try to drive more visitation to us. So with that, I will give it to Mr. Soporowski, our board chair, to give you some information.
Well, thank you. I appreciate that, John. From my aspect, I just want to let everybody know that, you know, we operate on a zero-based budget. So we start with the revenues, and then we are challenged to spend all of that money. And one of the things that we did as a board is we reviewed this budget with John and Donna line by line. And I think what we came up with was a great product because the majority of our emphasis has been into the marketing and sales, and that's where the money needs to go. From the aspect of Donna's organization, I think those people do a great job. We have done a number of things this year. Their sales team has worked very hard to bring more and more conventions and visitors to the area. We've done an excellent job with PR, which we haven't done before. Julie has done a tremendous job with that. Now we have state recognition, so we are getting a lot of exposure within the state. So overall, I would say that from my standpoint, and as we reviewed it with the board and approved the budget for John, that everything that we saw in there makes great sense. I think the allocations are right on the money, and I think that we'll have a tremendous year in fiscal 14 and 15 as we continue to grow our tourism base in this community.
And I think that's it for us, and we are open for any questions.
Commissioners?
Well, I'll just say thank you for what you do. I think that from a local standpoint, I have heard more comments from Cabarrus County residents that experienced the procession of Mustangs from Concord to Kannapolis. And I think that really brought home to a lot of folks the amount of tourism activity that's going on here, because sometimes we're involved in our neighborhoods and jobs and we don't realize how important that is. And so I think that was great on a number of different fronts, but particularly letting our citizens see just what a big impact it does have. So
Thank you. And I will say that our staff worked very hard, but also it takes partnerships to be able to make those things happen, because we don't have a lot of the infrastructure as far as large buildings to enable us to do indoor recreation and things like that. So we have to rely on our partners to be able to do those things, like the horseshoe pitchers. That event, if we're awarded that, would happen out at the arena, which is a perfect venue for them. The Mustang could not and would not have happened without a relationship and a partnership with the Speedway. So we're very appreciative, and we thank you for the compliments, but it's not just the CVB. It is the CVB in addition to our neighborhood partners that we deal with. And we had a run, a large color run that happened at the mall. And I know a lot of people would think, really, you had a run at the mall? Yes, it was prior to their opening, and we set up a course at the mall, and that would not have happened had the mall not been able to think outside the box and not just laugh at us or say no when we approach them and say, what would you think about us doing this? They had another thing that they did at the mall is it's called a motor coach rodeo, not as in people riding like a normal rodeo, but it is a safety event for the motor coach groups that they come in and these drivers have to do safety maneuvers, and they do that in the mall parking lot also. So I appreciate the kudos, but it's not just us.
Well, and certainly, and even more appreciate the partnerships.
Yes.
You know, I think perhaps that's a lesson we might take, that we look at more partnerships in the community, as well as you mentioned earlier, the disc golf project, which I think is exciting, and we'll take a chance to do a television commercial for that. Grand opening this Saturday at 11 o'clock.
That's right.
And they say hot dogs, which sold me. I don't know how many they plan to prepare, but they're supposed to be available for everybody.
And they're not Frisbees, just FYI. They're discs.
Disc, exactly.
Yes.
Exactly. Somebody schooled me on that the other day. But I think I've been surprised at the stories that I've heard of people from outside of our community that are already coming over to take a look at that. And of course, that is one of our county facilities that we're very proud of, Frank List Park. So we appreciate you helping to enhance that.
And we will work very closely with the Economic Development Office in maybe encouraging the headquarter for the disc golf to move from South Carolina to get them here.
Sounds like a good plan. Thank you.
If I may say one thing, if you don't mind, you mentioned partnership, and I think what's pretty unique about the board of the CVB is that it's a very diverse board and with all different needs. We have hoteliers, we have city and county officials, we have myself as a retailer, we have the Speedway, and it's a very diverse group. And one thing that's really unique about our board is that we tend to agree on things, and we have our tough conversations, but when all is said and done, it's not about me, it's about us. And I think that's the most important thing that I see, is that when we make a decision, we move forward to do something, we do it. And it doesn't matter what our interests are, it's for the interest of the community and the interest to grow the tourism base in this county. And I think that's the real thing about, you know, what makes us that successful in what we're doing.
Jason, anything? Larry?
Y'all are doing a good job. Thank you.
Thank you.
Thank you.
Well, I'm going to say, and I know you've heard this before, having lived in Cabarrus County my entire life, as a very young person, when I was growing up, the thing in Cabarrus County was textiles. We do still have textiles. We just don't have like it was when I was growing up. When I went off to college, Philip Morris came, and we had tobacco, which helped out because we were losing on the textile front. And that lasted for a good while, and we don't have the tobacco that we had. And now what we have that has kept Cabarrus County moving forward and not being hit as hard as so many other counties has been tourism. And people before us as elected individuals helped to get Concord Mills here, which made a huge impact. The Speedway's been here for a long time. All the hotels and the restaurants and all the changes that have gone on. I was talking to Bruton Smith this weekend, and I commented to him that I can remember being back in the day when you had a vehicle that didn't have seat belts. My family had what was called an old Dodge Rambler, and there were no seat belts in the car, and we would ride. My aunt would drive us on 29, and you could see into the racetrack and see Richard Petty's car going around. The old picture that you see of with the spoiler on it. But that was, you know, and then to go into Charlotte, there was nothing. University area didn't exist. UNCC was there, but there wasn't any of that development. And it seemed like to me that go to Charlotte was just the longest drive. Now, of course, we just don't even think twice about going to Charlotte, so or them coming this way. So it's been a huge change, and I think tourism has just made a phenomenal impact. And you're always very humble, and you're very humble with your staff. And you always throw credit to them for the hard work they do, and they do all work very hard. But you need to be recognized as the hard work that you've done. You've been an excellent leader for the CVB and a team leader. I'll say that because that's how you want it to be. But y'all have done a great job, and there are benefits to everybody in the county that tourism has done what it's done here. So is there anything else that anybody want to add or anything else you want to add?
No.
Okay, I have one
Sea
request.
Sea
Go ahead.
Life.
Sea Life is.
Sea Life is, I should have said it and I didn't, so my apologies to Sea Life. They are just breaking all of the records for their organization as far as the aquarium goes and the openings at other places. They have blown those numbers out of the water. So, no, another pun, but there you go. Pretty good at that this evening, aren't I? But anyway, so thank you for your partnership in getting Sea Life here. It's a great addition, and I think Merlin appreciates the camaraderie and the partnerships that happen to make that happen, and I am sure they will be maybe investing again in the future. That's
You know
a safe way
something
to
I
say it.
don't.
No.
We're hopeful. We're hopeful
They
that will.
should.
Yeah, we're hopeful that they will.
Well, they're watching it very closely. Because this is the smallest market they've opened in, and they're under a microscope, but the boys up in England are very, very excited about what they're doing here. In fact, they had a budget of selling 600 annual passes, and they sold 7,000. So, I think the other.
I meant blowing it out of the
yeah,
water.
and
I really
think
meant that.
the other thing, and we mentioned it earlier when we made the presentation, it is not only an attraction but also an educational type of aquarium, and we're averaging between 1,000 and 1,200 students a week that go through the aquarium, and that's been since the beginning of March. So it has definitely had an impact for bringing people to the area, but also from my aspect of bringing more customers to the center. So it's been a great addition, and I think that's going to continue to happen, and Merlin will continue to try to tweak that entertainment venue and bring in other attractions as they go along. So thank you again on behalf of Concord Mills and myself for your support in that effort.
I do have one request, because I follow Hot Shoe Harry on Facebook, so all of you should too. I've chuckled at how lucky Hot Shoe is on getting pictures made with quite a number of race car drivers, and I think there was one even at the All-Star race coming out to be introduced. Hot Shoe got to come out too. So the next group that's coming up is Cabarrus Arts Council, and while you guys are getting set up, my request is that the 4 county commissioners get a picture made with Hot Shoe so that we can show up on the Facebook page of supporting the efforts to try to bring the horseshoe pictures. That was something that you probably did when you were growing up, didn't you? Pitch horseshoes? Yeah, me too. I'm not certain that my own children have done that, but younger generations maybe not as much, but I think that we ought to show that we support trying to get that effort. So you want to?
Before, if you can.
Oh, I'm sorry.
That you approve their budget at this meeting.
Okay.
That's okay.
So do we need to make a motion to suspend the rules then? Or since it's part of this, to just make the motion?
To be on the safe side, suspend your rules.
Okay.
That would be good.
So there's a request. Sorry, what page is that? 99? If you will look at 99. Sorry. So at this time, I would accept a motion to suspend the rules and address the budget request for the CVB. Do I have a motion? So moved. Do I have a second? A motion, second. All those in favor say aye. Aye. Any opposed? Okay, so the request from us is to approve the Tourism Authority's fiscal year 2015 budget totaling $4,251,467 in accordance with Article 4, Room Occupancy and Tourism Development Tax, Tourism Authority of the Cabarrus County Code of Ordinances. Do I have such a motion? So moved. I have a motion. Do I have a second? Second. A motion and second. All those in favor say aye. Aye. Any opposed? Okay, that should make you happy. Okay?
Thank you very much.
Take a quick picture, and if the Cabarrus Arts Council will make their way up, that would be great.
Okay.
Wait, Mike's fine. We're gonna do them. Okay, you're fine. No, you're fine. Y'all gonna come for horseshoes? You gonna come for horseshoes? That'll be fun. Okay, whenever you're set, whenever you're ready.
Okay.
You can- Yeah, I'll introduce you. Okay, well, that was fun. Okay, hopefully y'all smiled well, so. Okay, next we have the Cabarrus Arts Council. So what we have done so far, we have some new folks here. If you have a mobile device of some sort, please make sure it's on silent or vibrate for the remainder of the meeting. And what I'd like to ask you to do is, we know who you are, Noel, but if you will introduce yourself and anybody that you have with you. Sure. I think you have some people in the audience in addition to the three of you up here. So if you'll introduce everybody that's here, and then you have the microphone to do your presentation.
Thank you so much. I'm Noelle Rhodes Scott. I'm the president and CEO of the Cabarrus Arts Council, and thank you so much for allowing us to be here. I'm going to actually let everybody introduce themselves, if that's all right.
Dan Boone, board chair.
Lisa McCombs, operations director.
If everybody else will stand, because we've got a nice little group here.
Keith Gale, board member.
Rebecca Collins, visual arts director. Sarah Sanborn, finance director.
Ruth Pruitt, board member. Pat Verner, communications director.
Bill Dush, past chair and corrosion.
Mark Russell, board member.
Thank you so much. We are here to thank you for your support for so many years and to just give you a little bit of an update on what we use your funds for. We have received $26,000 from the commissioners every year since 2000. We've applied for the same amount this year, and our budget for the incoming year is basically stable. I mean, it is stable, but it's basically the same as the current year. So we'll go through and talk a little bit about what we do. The Cabarrus Arts Council energizes our community through arts excellence, providing programs and services to 350,000 participants annually. We would like to thank you for making the Cabarrus Arts Council a reality. In 1982, the county commissioners appointed the Arts Council to serve as your designated county partner. As such, we apply for and receive grassroots funding from the North Carolina Arts Council each year. In 2013-14, the council was awarded $39,500 from the state. That funding leveraged another grant, and we distributed $50,348 to Cabarrus County arts programs. And this year's participants and recipients included the North Carolina Music Hall of Fame, Old Courthouse Theater, Piedmont Choral Society, Southern Piedmont Woodturners, Union Street Live, Spring Into Arts Festival, Hospice Interlude Program, Kannapolis's Concerts in the Park and Thursdays on Main, the Logan Community Daycare Center Music Program, Multicultural Student Union Dance Program. In 2000, the county commissioners awarded funding to the Arts Council to hire an executive director. Thank you for that. In 2005, the county commissioners invited the Arts Council to move into the historic courthouse, which gave us the opportunity to create a Center for the Arts in this beautiful building. Thank you for that, too. The Arts Council created the galleries on the first floor of the building, and that attracts visitors with 5 annual art walks and exhibitions every year. This past year, we had over 15,000 visitors to the galleries. The council created the Davis Theater in the former courtroom and turned the former attic into attractive dressing rooms and meeting space. That was quite a difference from how that attic was before, if anybody has been up there. The Arts Council so far has put $450,000 into the historic courthouse building. The once closed building is now open Monday through Saturday and attracted over 15,000 visitors in 2012-13. All 3 floors are used almost daily. Thank you. Because of your support, the Arts Council is able to work with the school systems to augment our students' art education. 30,000 students benefit annually from these programs. Through the Council's students take part in the arts program. Every student, kindergarten through 8th grade, and every high school sees a professional, curriculum-related performance every year. Elementary school students are taken to high school auditoriums for their shows, which saves money and shares school facilities. Students now come to the galleries for free field trips, and school choruses perform on the front steps of the historic courthouse. The Arts Council works with many partners to support and promote the arts across the county. The arts are an economic catalyst, providing jobs, enhancing education, attracting visitors and businesses. At our breakfast 2 weeks ago, where 720 guests came to support the Arts Council, Secretary of Commerce Sharon Decker spoke to the necessity of the arts in recruiting business to the state. Thank you very much for your support of the Cabarrus Arts Council and for making it possible for us to work with many partners across the county to bring arts to 350,000 participants every year. And we'd be glad to answer any questions. I gave you a little annual summary of our fiscal. One of the things that I think is interesting to point out is that when you look at our expenses, we have 31% of our budget goes to performances, exhibitions, and only 18% goes to general administration. We work really hard to keep it fiscally sound.
If I could jump in, again, Dan Boone, and my background's accounting and finance, and I'm a lifelong Cabarrus County resident and proud to be one. And I've been involved with the Arts Council for a number of years. When I get involved in an organization, I'm very interested in the finances and the controls. And in our organization, I've been extremely pleased. We have, of course, a budget that we adhere to. Each month, that budget is reviewed in detail by our finance director, Sarah Sambor, and treasurer, Bill Dush. They bring to the executive committee, line by line, any exceptional items, and then we discuss what is going on, what should be done, is it okay? Then once the executive committee approves that, it goes to the full board. That's done every month. So we keep control of the money that we have. And then secondly, we have an audit every year, and last year's audit was totally clean and no real suggestions to improve. Again, that's important to me, and again, knowing that you guys are spending money, I think it should be important to you as well. But we do thank you very much for your support.
Okay, Commissioners, I'll open it up for any questions or comments.
All I say is it's funds well spent.
I would agree with Commissioner Burridge, and thank you for what you do. You know, I think you've done an excellent job of pointing out the broad range of people you touch in the community, and I think all of those pieces are important. Certainly the benefits for the school children, the exposure that they get. For me personally, the fact that you're protecting our heritage and historic building, and we support you financially doing that, and I think that is money well spent, and I can think of no other purpose for that building that would be more appropriate and give greater exposure to our citizens to have an opportunity to come in, look at what the things that you provide, as well as the history of Cabarrus County. I, as you know, personally purchased tickets to your Davis Theater series of performances and enjoy those tremendously, and I think that's an offering that a lot of people don't know about and don't realize what they're missing out on. But it really gives a flavor to Cabarrus County that otherwise would not exist. And I think that's just one of the things that makes this an even more attractive place to live and do business. And so I appreciate what you do, and I also think that it's money well spent. Thank you.
Thank you very much.
I'll make it unanimous. I appreciate what you do, and I think we do get tremendous value from the services you provide. And I want to thank you personally for working as hard as you do to fundraise and to come up with as many private funds as you do. I know you work very hard at that and have a lot of different events and things like that, and I appreciate that. I think that's a great partnership. Noel, you've invited me out to several things, and with two little ones, I've had a hard time. I've come out to a couple of things, but I do look forward to coming out in the future, and we thank you very much.
Thank you.
All right, anything else you want to add?
Just thank you very much. We do appreciate it, and when we moved into the historic courthouse, that just opened up a whole new world to what we could do, and thank you for that opportunity again.
Thank you very much.
All right.
Appreciate you.
Thank you.
Commissioners, we have in our agenda a 10-minute break. So we'll take 10 minutes, and while we're taking our break, next up we're going to talk about volunteer fire departments. So Steve Langer and whoever's coming up, yeah, if y'all come on up and get set up so that we'll be ready to go in 20 after. Thank you.